Go ahead, ma'am.
Hello all, I am Dr. Hema Vaithianathan, Fertility Consultant at Oasis Fertility, Chennai. So today in this session, let's understand about IVF and recurrent miscarriage. So let's understand about what is repeated miscarriage as a condition and what are the reasons behind repeated miscarriage and about some of the tests that are done to identify the underlying causes for repeated miscarriages and about the treatment options. And if IVF is offered as a treatment for recurrent miscarriage, and how IVF can help couple with repeated miscarriage is what we can understand from this session. So about repeated miscarriage itself. So recurrent pregnancy loss itself is a very a disappointing situation. And if a couple experience repeated failed miscarriages, and if there are two or more failed miscarriages that happens before 20 weeks of pregnancy, then we can identify the situation as a recurrent pregnancy loss condition. So most of the pregnancies, almost about 20% of the pregnancies that are miscarriages can happen. But repeated miscarriages happen in around 2 to 5% of all couples. And sometimes, even after extensive investigations, recurrent pregnancy loss remains unexplained in about 50% of the time. So there are some unexplained reasons underlying this recurrent miscarriages as a condition. So, what is causing these miscarriages? If we understand about the reasons of even any, not even repeated miscarriages, and generally as a miscarriages, some of the reasons behind, or the most common reason will be random chromosomal variations in the embryo is formed. So chromosomal and genetic variations are the most common reason why miscarriages happen. Sometimes it is because of parental chromosomal variations that is resulting in the formation of an abnormal embryo that has more chances of miscarriage. And so for a miscarriage to happen, it can be the problem can be either in the embryo site or it can be in the uterine environment that is causing these repeated miscarriages. So uterine problems sometimes can be an underlying reason why there is miscarriage, and sometimes it's because of immunological reasons. In a way, the maternal reaction to the accepting the fetal tissues can be a problem at the immunological level, resulting in miscarriage. Sometimes it is because of blood clotting abnormalities, and sometimes because of other medical conditions and hormonal imbalances like very uncontrolled thyroid problems, especially thyroid issues involving autoimmunity, or it's because of uncontrolled diabetes mellitus, or because of other hormonal problems like prolactin issues or underlying hormonal imbalances. But out of all, age is the most important factor. For example, like after 43 years of age in a woman, there is 50% chance of miscarriage. So when a couple experiences recurrent miscarriages, if there is two or more miscarriages happened, then it really warrants some investigations, and these tests identify um, issues in relation to the embryos or issues in relation to the uterus or other genital hormonal and medical issues. So, but some of the common tests or the important tests that has to be done for a couple experiencing recurrent miscarriages is chromosomal testing of the couple. So if both for maternal side as well as paternal side, chromosomal testing known as a karyotyping testing is an important test that identifies if there are any chromosomal issues that is resulting in formation of an abnormal embryo that is prone to miscarriages. And also visualization and evaluation of the uterus, especially the uterine cavity, is an important investigation also. So some of the tests that is done to identify the uterine problems are a general pelvic ultrasound and also a special type of an ultrasound known as a three-dimensional ultrasound. As you can see in this picture, can give us a very good idea about the any shape abnormalities in the uterus or presence of any space occupying problem like fibroid or any other endometrial polyps or uterine anomalies can be easily detected by this three-dimensional ultrasound, and so that helps us identifying if that is a reason underlying these miscarriages. And some of the problems like septate uterus, where there is a inner wall that is developed inside of the uterine cavity that is disturbing the implantation, or sometimes an anomaly uterus known as a biconate uterus. And the uterus is double uterus, or sometimes another anomaly known as tidal phase uterus. There can be various type of uterine anomalies that may be causing recurrent miscarriages, and some of these anomalies, if detected, need to be corrected. For example, like septate uterus can be corrected if the couple experiences repeated miscarriages. And also, general testing is involved to rule out thyroid issues, to rule out prolactin issues as a reason. Because thyroid issues, as we all know, it can be an hypothyroid issue or an hypothyroid issues. Sometimes thyroid issues most commonly it occurs because of autoimmune diseases. So some of the time antibodies are produced that act against our own thyroid tissue, resulting in underactive thyroid gland, or sometimes it can even stimulate the thyroid gland, resulting in overactive thyroid production. So in that case, if there is a thyroid autoimmunity, especially involving multiple autoantibodies, so it requires correction it requires thyroxine supplementation and to bring back the thyroid hormone levels in the blood to normal level in an attempt to to treat it, to improve the condition, to improve the health of the mother, to support the pregnancy. And also it's important that we do an glycemic evaluation, that the blood sugar is checked, and especially the blood sugar as well as the hemoglobin A1C testing is done in order to identify if there is any underlying diabetes that we are missing. And also another important group of tests is known as a thrombophilia testing is also done. And also another group of antibodies that is tested is antiphospholipid antibodies. These are a group of antibodies that can result in formation of clot at the maternal and the fetal interface when the vascular connection is established. It can result in clot formation, and that may be leading to repeated miscarriages. And hence, thrombophilia testing and antibody testing, especially antiphospholipid antibody testing, is one of the important evaluation for a couple experiencing recurrent miscarriages. So there are more than apart from this list, there are other testing and is available, but it is all done on an individualized basis. So there is no such a list of treatment, a list of testing that is offered for a couple experiencing a pregnancy loss. It's usually an individualized type of evaluation that is needed. But the common test that has to be done is this karyotyping of the couple and hysteroscopy or three-dimensional ultrasound to evaluate the uterine health. And about the general hormonal testing is an important basic evaluation needed for couple experiencing pregnancy loss to identify any reasons, that any underlying cause that can be corrected, and so that it prevents the miscarriage in the future pregnancies. So as such, in couples having this pregnancy loss as an issue, as such for them fertility is not an issue, because the conception happens, but only after implantation when the fetus is developing. There are issues, and it can result in missed miscarriage, or it can result even after formation of the fetus, and even after the cardiac activity or the heartbeat is seen, sometimes miscarriage happens. So it actually, the fertility is not an issue, and the fetal development in the initial stage is not an issue sometimes. But after that, the sustaining the pregnancy beyond a certain gestational age is a problem with recurrent pregnancy loss. So when the couple has no problem in conceiving, but still in some situations IVF is offered as a treatment option for couple experiencing pregnancy loss. So let us understand why and how IVF can help in couples experiencing recurrent pregnancy loss. So for example, like why IVF sometimes is offered for couple experiencing pregnancy loss is because during IVF or as a pre-IVF evaluation, we tend to screen for identifying any reasons underlying these pregnancy losses. So there is always a pre-IVF evaluation where all the testing, as I mentioned, is done, and this screening is done extensively, and then underlying conditions if being detected, it is then corrected, and then treatment is advised to optimize the health of the mother before attempting a pregnancy. And also with IVF, the time to conception is reduced, but it also depends on other factors like there is sperm parameters are abnormal, or if there is any other issue. So then IVF can help such couples to reduce their time to pregnancy. Also during IVF, sperm selection techniques or other additional or add-on treatment can be offered so that it can improve the quality of the embryo that is formed. For example, some of the add-on options that can be offered during IVF is the sperm selection technique. Sometimes it is the embryo is formed abnormally because of the DNA that is passed on from the sperm is abnormal. If that sperm has a more DNA problems, like known as a DNA fragmentation is high in that sperm, it can result in the formation of an abnormal embryo. Sometimes if DNA fragmentation in that sperm is high, then the sperm selection technique can help. And also there are other indications that why we offer sperm selection techniques in couple experiencing repeated pregnancy loss, so that we can identify a sperm that can result in the formation of a very good quality embryo. And also during IVF, sometimes an additional option known as an ICSI is given as an option, so that we can select the sperm that is to be used in the formation of an embryo. And also we can ensure that fertilization failure doesn't happen. And also ICSI can help address another issues with related to the sperm as well as the egg. And also most important add-on option that is advised if IVF is given as an option for couple experiencing repeated pregnancy loss is PGT-A or PGT-SR. So this is known as a pre-implantation genetic testing. So this is offered as an important testing for couple undergoing IVF, especially in the setting of recurrent pregnancy loss. So how this pre-implantation genetic testing can help is because we can, once embryo is created, we can identify the health of the embryo. We can identify the genetic component of the embryo by this PGT-A testing, so that we can find out embryo with a normal chromosomal or the genetic component. So if we could identify an embryo with a normal genetic component, then transferring this kind of a healthy euploid embryo or the embryo with a normal genetic component can result in a little increase in the success rate, and also it can significantly reduce the risk of miscarriage that can happen even sometimes during IVF cycles also. So PGT-A is an important add-on treatment option that is offered to couples experiencing recurrent pregnancy loss when they undergo IVF in their further cycles. And also sometimes we can combine immunological treatment to couples if immunological issue is identified during evaluation, or sometimes it is even offered empirically in very selected cases to reduce the risk of miscarriage. And also around the time of embryo transfer, a good hormonal support and a good emotional support is given during IVF cycle, so that it can sometimes support the pregnancy in the very early stages. And in such a hormonal support sometimes can reduce the risk of miscarriage in a couple experiencing this kind of situation. And also during IVF, because we are following up the patient from the time of embryo transfer to the time of testing for the positive pregnancy, this kind of very early pregnancy care is offered and support is ongoing in an IVF cycle, so that that early pregnancy care or support, if it is taken care, it significantly can reduce the miscarriage risk also. And as mentioned, for a couple experiencing recurrent pregnancy loss, the sperm health is also important because, as mentioned, the DNA fragmentation or any proportional DNA damage can affect the formation of the embryo. It can result in formation of an unhealthy embryo. So as mentioned, sperm selection techniques is an important add-on technique during IVF cycle. It can significantly improve the sperm quality, and also it can overcome potential male subfertility in recurrent pregnancy loss couples. As I mentioned, ICSI is also an add-on treatment option. ICSI is intracytoplasmic sperm injection, where a single sperm is injected directly inside the egg, so that it can enhance the fertilization and can result in a formation of an embryo. And ICSI is usually done to treat male factor problems, but it also is offered in other situations, like patients if they require pre-implantation genetic testing of embryos, or sometimes when testicular sperm is used, or sometimes for cryopreserved eggs, or if there are low egg reserve in the women undergoing IVF. ICSI is offered as a treatment option, but ICSI is also an important treatment option with recurrent pregnancy loss couples if male factor is there. And as I mentioned, important add-on testing that is offered for couple with recurrent pregnancy loss is this pre-implantation genetic testing. So pre-implantation genetic testing is an important test that is offered. So pre-implantation genetic testing may be used in conjunction with IVF also. Pre-implantation genetic testing is usually of three broad types, which is pre-implantation genetic testing for aneuploidy known as PGT-A, which is a general screening test, and also we can select for particular genetic problems that runs in a family, like pre-implantation genetic testing of monogenic disorders, and also sometimes the gross structural variations in the chromosomes can be identified, which is known as the PGT-SR. So there are three broad types of PGT that can be done, and the most commonly test that is done in the setting of recurrent pregnancy loss is PGT-A and the PGT-SR. So pre-implantation, as I mentioned, pre-implantation genetic testing is an important test for couple experiencing repetitive miscarriage, but there are also other indications for which PGT-A is offered. But PGT-A is usually done for to screen for chromosomal abnormalities in the embryos. So it can be done for couple where the maternal age is advanced to 35 years of age, or if there are severe semen abnormalities, and if there are multiple failed IVF attempts or multiple miscarriages or pregnancy prior pregnancy with anomalous fetus. For those, pre-implantation genetic testing can be offered as a treatment. So apart from this, there are a lot of add-on IVF treatment options, which is only offered as an individualized or a tailored option to a couple in some particular situations. There are a lot of add-on options like assisted hatching as an option if there is an oocyte abnormality, or sometimes frozen eggs are used. Assisted hatching can be used as an option. Embryo glue is an option, and immunological therapy. All these are add-on options that offer good success rate in selected cases only. And it's generally not offered as to all the couples experiencing repeated pregnancy loss. So that was all about the role of IVF in couple experiencing recurrent miscarriage undergoing IVF. So hope that answered some of your doubts about use of IVF in recurrent miscarriage. So thank you all.